Measles has been on the rise in Ontario in 2024. Rates have been kept low due to immunization, but many of the cases reported have been due to travel. And experts are warning that traveling during the holidays can help spread this highly contagious virus.
We're seeing a global resurgence of measles. This is not just a Canadian issue; it's a global issue, and it's a really awful infection. It kills about 100,000 people on the planet every year. The vast majority of them are children.
Canada has strong vaccination programs, but measles is highly infectious. Transmitted through the air, even a slight decline in vaccination rates can lead to a significant rise in infections.
If someone with measles was, for example, in a room and then they had left the room and might have been out of that room for half an hour or so, if a non-immune person then entered that room, there's still a reasonable probability that that non-immune person would get the measles. Like it's that transmissible.
63 cases have been reported in Ontario in 2024 across 12 different public health units. 43 were children or adolescents, 40 of which were immunized. 20 were adults, 10 were not immunized.
While 63 cases in a province of about 15 million people doesn't sound like much, we still have to be pretty careful. It's very transmissible. There's not a lot of wiggle room if vaccine rates start to slip.
A 5-year-old child died in the spring, while 7 children and 1 adult were hospitalized throughout the year. Infectious disease specialists stress that you can be infectious before you know you're infected. Early symptoms may show up 10 to 14 days after infection and include a fever, cough, runny nose, and red eyes. And patients are usually sick for about a week.
Sometimes it can lead to more severe complications, such as lung infection, brain infection, meningitis, and issues with the vision, for example.
Since October, 37 cases of measles have been linked to a single travel-related case from New Brunswick, affecting 3 Ontario health units. The extra travel and visitors during the holidays can increase chances of exposure.
If people want to reduce, not eliminate, but reduce their risk of infection, especially respiratory infections, they can put on a mask in an indoor setting where the vast majority of respiratory viruses are circulating.
The most effective way to reduce measles continues to be vaccination. In Toronto, Beverly Andrews, City News.